First of all, thank you so much for doing this. It's an honor to have you. You are obviously an icon in the world of low carb. You've been doing this for, I guess, the better part of your life, and probably have more practical knowledge than just about anybody, particularly clinical knowledge. So it's great to have you there. And every time I've got the pleasure to talk to you, you're very just pragmatic and practical and down to earth, and this is what works and this is what doesn't. And you don't get too hung up in the minutia, which a lot of people kind of do. But at the same point, you understand the minutia, what's minutia and what's important and what's not. So that is great. Now you're still at Duke, I assume. Is that your normal residence?
Yes.
Can you just, by way of introduction, I was going to give you 2 minutes for those that may not have heard you. And I would suspect that the vast majority have, but this is going to be recorded. So people that aren't aware of your work, can you just briefly summarize in a lifetime's work in a minute, something like that, Eric? Just whatever you want to share, please.
Yeah. So I'm Dr. Eric Westman, and I'm at Duke University. I'm an associate professor with tenure at Duke. I had about 10 years of clinical research in low carb diets, doing as my brother says, that's my brother. He validated the Atkins diet, so he can summarize it all into one sentence. But the work we did, Dr. Yancey and I at Duke were curious about the Atkins diet, whether it was healthy or not. Everyone knew it was unhealthy, but we're more data driven than that. So we had a couple patients who got better, followed the signal and data, and now 20 years later, we now have about a 14-year clinical history now at Duke. We opened a clinic after about 8 years of research. And now basically I'm still working in the keto medicine clinic at Duke and teaching this all over. I was in 8 different countries last year teaching. It was like I just got it in before now, I don't know when we're going to travel again. But so, you say that, or mention that I'm often practical and pragmatic. Well, that was extremely important for me as a physician. I'm an internist, now obesity medicine specialist. I had to have things that were very practical, something that I could use every day. So the other part of my career is I got into the leadership of the Obesity Medicine Association, which is the largest group of doctors who help people lose weight, the medical doctors, not the surgical ones. And so I've learned a lot about what other doctors do in terms of helping people to lose weight. And, obesity medicine I practice the best internal medicine today that I ever did, because I fix diabetes, I fix high blood pressure, I fix obesity, but I use a tool that most doctors don't have, and that's changing the food, understanding how the food can fix all of this. And so I'm really happy to be with you again, Sean, Dr. Baker, because the meat connection is huge. And I'm really excited.
Eric, I want to, because you're doing, besides being at Duke, I had the pleasure of speaking at one of your ADAPT conferences, and you've got kind of a roadshow going. So your mission is to sort of reach out to people. Can you talk a little bit about the ADAPT program for people? I know a lot of people aren't familiar with that, so I know that'd be fun to talk about too a little bit.
Yeah, and so as you can see, my career and my background has been in academia. I also have a company, so I forgot to talk about it. Adapt Your Life is an education and product company that teaches low carb diets, and over the last 18 months, we had events around the country. You were able to speak at one. That was the last one we were able to do in Long Beach. And actually that was very influential for me to see people coming out locally. So that, it didn't take a whole lot of time. You just drive to the Cal State campus and you're there, and the very, helpful in so many ways. We brought local leaders together to meet local followers. And so what was really exciting is seeing the connections that we were making with people if they needed help clinically. And the ADAPT products have scaled and actually gotten better every time, so that they're available for purchase too. And I guess the big news, it's not quite out yet, is that we have a book that's coming out, and we'll be able to teach. Basically, it's kind of a life culmination for me of teaching not only a keto diet, but a lower carb diet, and understanding who can do what and or likely be able to do certain things, because not everyone has to do keto, I don't think, and there are, and even if the social pressure is that, well, I want to have vegetables for whatever moral religious purpose, I mean, I feel like I need to provide an answer for that. So yeah, we're gonna have a book coming out we're working on some courses, and it's gonna be an exciting time over, it's probably 6 to 8 months before that comes out. Yeah, that's Adapt Your Life. Adapt Your Life has a YouTube channel where I put, now over 100 YouTubes, and my style is that it's very quick, very brief, and practical.
Yeah, and I think that's what makes it approachable for people. When you start giving them a formula of 50 hoops to just eat, it just really frustrates people. And I think like you said, I mean, and, obviously one thing that you said, he said, well, if you don't like vegetables, you don't have to eat them. That type of thing. I mean, and again, obviously that's a controversial statement in a lot of circles, but I mean, I don't find it that controversial. I think ultimately you do what works, and I'm the same way with a carnivore approach. Some people use it, some people do well with it, some people do it some of the time, some people do it in a modified fashion, some people do fine on keto, some people do fine on low carb, some people do fine on a high carb diet. I mean, I think we have to find our balance there. I want to know, and I know you've seen this because since I've been looking at this stuff, about a decade that I've been kind of interested in nutrition, but it seems like this low carb approach, particularly keto, and now this carnivore approach is constantly being demonized, criticized. I mean, there's mechanistic stuff that comes out there, and I'm sure you've seen it all. I mean, what is the rationale behind that? Is there any science to that? Is it, I mean, here's one thing. I don't know if you have any thoughts on this, because I see sort of one of the latest things they're talking about is now branched chain amino acidemia. So if you have branched chain amino acids in your bloodstream, it's associated with insulin resistance. Therefore, eating branched chain amino acids in high amounts, i.e. animal products, results in insulin resistance. And what I look at some of the Mendelian randomization studies, and they show that it's an effect, not causal. We have problems with the breakdown of a branched chain amino acids. And again, it's a chicken or the egg type thing. And they always sort of get this association, and then they run with it without any confirmation of causality. Do you see this? Is this just a repeated pattern? Is there some malice of forethought into this? We're just going to find a spurious sort of association, then we're just going to say, well, that's the answer. And when we look at it any further, you know how it is. You have to refute the BS, and it takes 10 times the work.
Yeah. Well, so it's easier to do an association study than a causation study, right? Much easier. So, and in fact, gosh, we can go back. I started as an internist in actually the field of addiction and smoking cessation. I met by chance the inventor of the nicotine patch, who had moved to Duke, and I was working with him on this program where you had this thing you put on the skin and it made people not smoke. And what was that? It was one of the first nicotine patch studies. And so my training is in clinical trials using different interventions in people. These are difficult studies to do, often several years. Yeah, you need money, you have to get grant funding, so you have to convince someone else that it's worth doing. And compare that to an association kind of study where you ask people what they ate and then look at the blood and all this, or even I'm kind of familiar with some of the work looking at metabolomics, where then they drill down to branched chain, and then therefore, well, but these are still association kind of studies, which you're calling out appropriately. It doesn't prove that when you manipulate it or change it, that you're going to have the result that you think you're going to have. So I think there's the easy pathway to publication and then getting more research. And of course, a researcher never wants to really answer the question. A researcher always wants to do more research. And this was one of the times when I fell out of the research world, because I guess I'd done enough research to start doing it in my practice, So, and of course, the money to do low carb studies was, a trickle at that and fortunately it's gearing up again. But yeah, I think it's easier to publish association kind of research, and the filter for the media and even the pundits in the nutrition world is very, very minimal. I mean, you can get the news to say just about anything if it was a study. The branched chain amino acid kind of has me befuddled as well, you know, because I'm always asking now, should I add something to a low carb keto diet? You know, it's, to me, it's not enough to say, well, if you eat carbs, you do this, and you have a, well, that doesn't, I don't really care about that anymore. So I've narrowed down my sphere of what I'm interested in to, does it really add anything to what I do, which is really just change people to eat different kind of real foods. So I'm not a big supplement guy. You know, I suppose if I was selling lots of supplements, I'd say, oh, branched chain amino acids, there's an association. And I'm a outcome kind of guy, which means I don't hop on the latest sort of association research, but which you don't either, which I really like.
Yeah, I think outcome is what I mean, that's the end of the day, what people care about, what I care about. I mean, you know, it's fun to talk about the mechanisms and stuff like that, but at the end of the day, we want people not to be sick. Hey, I want you, if you don't mind, I'm sure you saw Kevin Hall's latest sort of study looking at, it's the plant-based low-fat diet versus a quote-unquote high-fat animal-based diet. And the results. There's, obviously the people in the plant-based world were saying, oh, look at this, it shows great things. You know, we lost more weight, we were just as satiated. One of the often cited benefits of a high-fat diet is satiety. And so I wonder what is your interpretation of his results? Obviously, it's a 2-week study. Obviously, it's not long-term. Obviously, it's a metabolic chamber, which is not a really free-living situation. It doesn't give it, you had really restricted access to what foods you had. How do you interpret that? I mean, how do you interpret the fact that they ate 700 calories more than the other group and still lost body fat? I mean, what was their baseline numbers? What are your thoughts on that whole sort of study?
I have a confession. I haven't read it.
Okay, well, never mind then.
When
I've read it. Yeah.
I've seen people and saw comments about it, and when I saw 2 weeks, it's like, okay. I mean, you're going to see what you want to see. And in fact, what I don't understand about the good Dr. Hall is this isn't a all or nothing, zeros, my way or your way. Can't there be many ways to go about this? Does there have to be a one way that's superior? I mean, so that's where I just kind of fall out of those arguments and say, again, I'm an MD, not a PhD. The old story is PhDs argue over the number of angels that can fit on the head of a pin, and that's what I think is going on there. With Dr. Hall, Kevin I lost confidence in him as a researcher when he wrote an article and the methods showed one thing and the summary showed something else. So when you, and I assume it's because of political purposes, it did. So when the data shows something and then the summary of it, which most people will only read, shows something else, there's something else going on. And so I'm actually kind of concerned that he, might not actually, you can actually see what you want to see sometimes, or you can inadvertently create a research paradigm or study to see what you want to see. And I have to wonder if the 2-week duration, well, it could have been because it's an expensive study to do, but one of the classic studies to dismiss the low carb diet, the Atkins diet, was to do a 2-week study. It was all water loss, and then people went back on eating carbs and see, it didn't work. That was a study by a prominent obesity researcher, and they did a study to show that the Atkins diet didn't work. Well, but all you had to do is talk to Dr. Atkins, and well, if you kept people on it for a month, they would actually lose even more weight. So the 2-week duration these days has me just kind of like, you're just trying to make a splash when you're really not pushing the science.
Yeah, I think 2 weeks is why bother. And he does cite, the cost of metabolic wards, which I'm sure obviously are expensive. So you've been, how many patients have you seen clinically and put on this diet over the years? Would you estimate, or do you know, maybe note to the number? I don't know.
Yeah, well, as an academic at Duke, I don't have, we went to different computerized programs and all that. One of the med students who was on my medical school rotation, I've been supervisor of a rotation for now 10 years, where people can learn about different weight loss methods, not only low carb, but also higher carb or surgical and medication and all. But one of the students came through and said, well, I'm a data geek, data guy, let me go review. So he pulled out the clinical charts, and we saw about 5,000 people over the 5-year period. And not everyone stays on the program. I mean, that's a clinical reality. Pulling out the data within EPIC, which is the computer program, he basically could show that we helped people lose 28,000 pounds over that period of time. So it's fascinating, because you don't ask a surgeon to show that a hip replacement works in his own or her own clinical practice. The studies are done, and hip replacements work because you use it, you do it, right? But blinders are so strong. Well, you haven't shown that it works in your practice. Well, we did the studies to show, 2002, 2004, 2006, 2000. In the research studies, we showed that it worked. We don't have to show. Well, we now have that level of detail, but it's not quite publication quality. But so somewhere between 5,000 and 8,000 people in a kind of consultation clinical practice, and I decided to create my own practice that was not internal medicine anymore, so that I can focus on lifestyle. And so if someone comes in saying, I'm having chest pain, I'll say, well, let's call the other doctor or call 911. Whereas as an internal medicine specialist, I used to have to deal with all that too. So I don't worry about flu shots and colonoscopies and all that anymore. But I practice the best internal medicine I ever have. I fix diabetes, and there aren't many programs that can do that. Surgical programs can. Bariatric surgery, they're the ones that have the data in the literature. So again, there are many ways to go about this. In my experience, the people stay in on average about 50% at a year. So if you kind of calculate back, maybe I've seen 4,000 patients for over a year, something like that. And then not all coming back isn't the only marker of success. I mean, some people come, they go to school, and they don't have to go back for remediation, So some people learn and they're gone, and I don't know what happened to them. But it's a great practice. People are happy, they get better. They're coming in with their clothes getting looser, shopping in their closet, and not paying for medications. And the weight loss is really just one aspect of it, and I'm really curious to learn about new diseases that get better. And that, again, I've used this in a clinical setting with people with all sorts of diseases and medical problems. The sickest people that I've had are the pre-heart transplant people who have left ventricular assist devices implanted. And the first patient I had came in with, and I'm like, you don't have a pulse. He said, yeah, I have one of these, LVADs. It's a battery pack. And I went, oh, and you listen here, and it's like, and then I'm like, well, he was actually introduced me to the cardiologist who's in charge of that program, who is very happy to have me help them lose weight to get a transplant. Duke has one of the biggest LVAD and heart transplant programs, and the first time I remember, he said, oh, I got to change my battery. And I'm like, right here? I mean, now? I mean, it doesn't get much to alarm me as a physician anymore, but to have them change the battery pack on the heart, anyway, it was fine. And now, I try to stump the students who come in, can you get this guy's blood pressure? And they look, oh, he's got an LVAD. He's got a battery pack on his, in his little satchel. And so anyway, it's great fun. And I'm very curious to learn about those who cut out all plants and seem to fix things that medical doctors can't fix, because that's kind of what I've been seeing for so long. Sort of the new frontier is what diagnoses and diseases can be fixed that the medication management, while people eat carbs, and can't fix. That's sort of the new frontier.
Yeah, and I see it every day. I see things, I mean, things like Ehlers-Danlos syndrome, which as you probably know, is a genetic disorder, people that their joints stop dislocating, which to me blew me away when I started seeing stuff like that. We see, I mean, the same cardiometabolic things you're seeing in the low carb world in general, diabetes, obesity, hypertension, those things improve. And then we see a lot of mental health issues get better, which is interesting. I've got Brett up there who cured lifelong depression and almost, I don't know if you want to call it schizophrenic type behavior, nearly kind of crazy, just plain, he'll say just plain crazy. And he's in there, he's been almost 700 days eating plant-free diet. But one of the things I want to ask you, because you talked a little bit about a kind of a nutrition rate, and what do you see? Is there a, can you say going in, like somebody shows up at your program and say, you are probably at higher risk for failing this treatment, or is there something that people actually do during the treatment that makes them more prone to fail? Have you seen a pattern? What seems to work consistently? And is there a person, maybe it's a psychological thing? Are there things that set people up for failure that you're going to say, okay, this person is more likely to fail and they need more support, more hands-on?
Yeah, I would love to see formal research about this. To any budding psychologist who needs a research project, because I think there are certain personality styles, certain, education level doesn't seem to matter. In fact, some of my best patients are they're just fourth grade educated. They just follow what the doctor says. And yes, in North Carolina, I have some people who are fourth grade educated. That's the other interesting thing about my practice. It's a all comers, insurance pay 90%. So Medicare, Medicaid, and I set that up on purpose. So I have all sorts of socioeconomic levels and educational levels. In fact, sometimes people are too smart, so smart that they double check me, or they say, no, don't, just turn off the internet. Okay, what about this study? What about just so. I don't think educational level matters that much, because the other thing is the teaching I use is just a sheet of paper. You just follow the food, and it would be even easier for just all meat diet, right? But you put the meat. Well, some people wonder, is pork meat, or is it? So I have a very simple system to is fish meat? So a very simple system of just a handout of the foods that you stay to. But psychologically, yeah, I think, of course, there's the carb addicts, the sugar addicts, who will gravitate back towards sugar if they're allowed to have any sort of sugar and starch. So that's where I think my background in addiction and smoking cessation in great detail comes into play. So that if it's someone who, I'll only do it a little bit here and there, but they're really an addict, they need to do the all or nothing cold turkey kind of approach, which I do in my clinic. So the other part of the kind of all or nothing personality can be good and it can be bad. So, and this is where I'd really like more detail in the research, because some people will be all or nothing and then be very strict, but then they kind of, the old saying of falling off the wagon, or I cheated, or, I mean, the language around this is also fascinating. You didn't cheat, so that, I'm not going to send you to the principal's office. You didn't sin to have, I don't need a confessional here, it's just carbs, and so if some people are all or nothing, they can be very strict and do very well, but then they can also fall off the wagon and say, oh, well, I failed. So I don't know, carbs coming back into the diet are the biggest predictor of this not being successful. We call that carb creep. And so we work really hard in the clinical program to keep people away from carbs as long as they can. This is the 20 grams or less. It would be like the meat-based all meat diet. And then if you get beyond a month or two, or so we really try to support people to stay away with sugar-free things. If sugar is the big deal, with chaffles, the cheese and egg waffle that you can make if someone's worried about or craving bread. There's the shirataki noodles that are available if someone's really missing pasta. So that's where the substitution thing comes from, the addiction world of getting people onto something else besides the substance. And then what's pretty interesting is that the cravings for all that stuff just kind of fades away. It's like you can it's harder to fool the eyes, but over time the brain kind of, it's not even doing the same thing that it used to do. That people will say, well, that cake didn't even taste very good. Or even some people will start developing symptoms from eating things they ate all the time. That's another fascinating thing, where if you might have been eating cake or donuts every day, but then you stay away from them, and then you have one and you don't feel well. It's like some people become more sensitive. I guess to loop back, I don't know exactly who's going to fail and who's going to do well. And I guess I use the language of I have to change the program so the program works for you. So I do adapt, and some people are on some carbs in my program. Some people are on medication, although it's probably about 5% who are on kind of appetite suppressant medication. I really try to make it a pristine, low carb, best I can, to see just what the diet does, or lifestyle.
There's a couple questions in the little chat that I want to just kind of run by you, and some of this is a little bit esoteric, but Stephen's asking about the role of incretin hormones and GIP, GLP-1. We know in diabetics that first phase insulin doesn't work and GIP doesn't work as well, and so on and so forth. But is there the knowledge of the incretin hormones, has that changed the practical approach in any way? Do we assess that? Does it make a difference, or do you have any comments on the role of incretins in weight gain, disease management? Can we do anything about it? It's kind of what it is, kind of my view, but.
Right. Well, so there's knowledge among carb eaters, right? And most studies are done among those who eat carbs. And that's going to be a very different effect on insulin and the incretins. And, I've kind of been, well, maybe it's a little intellectually lazy, but it's really being more specific to, well, when we start getting studies amongst those who don't eat carbs, let's see the relative effectiveness of those things, because what I do without knowledge of those things works just fine for those who do it. Now, so knowing those things, adding medication, there are a lot of low carb docs who add medications to the low carb diet. I don't do that. So that would be interesting to talk to the new generation of young doctors who use keto with medications. I think they may have a different perspective. For example, they would be able to say, well, we added Saxenda to low carb, it worked. I'm pretty sure that it will because of the studies done with Saxenda, which is the higher dose of liraglutide. But if someone said, well, Victoza with low carb didn't help, you would get a different perspective. I really don't know. So I guess I'm waiting for a practical application of that research.
Yeah, and I've seen all, again, you're talking about diabetic meds and GLP-1 agonists and, was it DPP-4 inhibitors and so on and so forth. Let me ask you about, somebody's asking about protein and fat. Now, in the ketogenic world, i.e. Steve Phinney, Jeff Folek, this is the, ratio, kind of this high fat, moderate protein. I think protein has kind of been, I don't know, it's back and forth. Mike Eaves was a big protein guy, and I'm kind of quite honestly, fairly pro-protein guy. Where do you fall on that, or does it depend on the individual?
Yeah, I think it depends on the individual. I'm glad you bring up Steve Phinney and Jeff Folek. We were co-authors on the New Atkins for a New You, and that came out in 2010. And then they did the books, The Art and Science of Low Carbohydrate Living, The Art and Science of Low Carbohydrate Performance, which are great, small, must-have on your bookshelf sort of thing. When you talk to Steve, and you have to kind of, Steve Finney, you have to know, so Jeff Volek's a PhD, double B, I think, the exercise physiology and nutrition PhD. I mean, brilliant. He's the go-to guy for research today at Ohio State. And I've known them for a long time. Steve, as a physician and researcher, you have to understand, he wants the perfect diet. And you're going to probably have a lot of people who are in search of the perfect diet. And so when he explains the protein and the fat on the axes right here, and he says, here is the perfect ketogenic, adequate protein, but not too much protein, and it's really difficult. He says that, so it's kind of like flying from San Francisco to Hawaii. You can't. It's hard to get to, and all that. That's not my teaching and my background. And the studies we did basically was cut the carbs, eat real food, no more than a cup of non-starchy vegetables, no more than 2 cups of leafy greens. So it's almost meatitarian totally. And what happened in the research studies on the metabolic wars is that people varied their protein and fat intake to probably what they liked and all that, and it still worked. So I don't think we know what the perfect diet is, and I'll even go so far as to say I don't know that everyone needs to be in ketosis. So that they've kind of, although I ask Jeff Volek every year, have you learned anything that tells me I shouldn't be doing this with people? And he kind of laughs, no, not yet. We've been doing this for some years now. And I said, well, you tell me if you find something. And so he's kind of like the guy in the crow's nest looking out for the end of the world. I'm down here asking, have you seen anything? Have you seen the edge of the world yet? And Steve's still, sticking to his guns, which he has since the 1980s, about how the keto has added benefit beyond not being in ketosis, being in ketosis. And I'm not so sure. So again, the practical reality is I can't get but a small fraction of people in the real world to do a keto diet. So do I say, okay, well, this is all I'm going to do, or do I acknowledge, no, maybe I can have a bigger effect personally if we say, just don't have sugar. So actually, that's going to be kind of the big mission and message of the new book coming out, is to stay away from sugar. And yes, you can do keto and you can do a meat-based version. And so anyway, I think maybe it gives you some insight when you hear people speak. Are they trying to find the perfect diet and everyone has to do that? Or are you trying to make something practicable, doable, feasible for more people? And in a general clinical setting in North Carolina, when I'm forced to deal, well, I choose to, but a third of my patients have type 2 diabetes on insulin. And I can achieve insulin elimination and diabetes cure by not having ketosis. So this is the balance. Now, am I a protein guy or a fat guy? I think the jury's out. I mean, I do kind of hold out that we might be able to do better than history. And I see a lot. I wonder what you think about the hunter-gatherer and people look back to history. But I remember vividly when the Cub Scouts here we met. We went out to Kitty Hawk, where Orville and Wilbur Wright did their first powered flight, and they looked at the birds and got the insight into how to make the wing. And then if they had done a review, just look back to should people fly? Should people fly? No, they shouldn't fly. So I think experimentation in science hopefully will bring us to a more perfect diet. So I don't, it's a lot of people do subscribe to the hunter-gatherer, paleo, therefore best. And, I think it's better than what we've had in America over the last 50 years. But so I don't know about the protein and fat. I'm not afraid of protein. And in Keto Clarity, another book that Jimmy Moore and I wrote, well, he wrote it and I helped. I provided the scientific and medical perspective on it. Kind of planted the seed that too much protein might knock you out of ketosis because of the gluconeogenesis. And I think that's real, but kind of overplayed. It's worried about a little too much. I certainly think eating fat is fine. Eating saturated fat is actually a healthy thing to do. Just to, I'm sure I'm preaching to the choir on that one. So if you stick to real food sources, not protein shakes, real food sources of protein, it's really hard to consume too much. I think some people worry about that.
Yeah, I think that's pretty accurate. It's tough to get, I think there's just a satiety effect and appetite effect for most people. Some, there's always the exception to the rule. There's always people who can break the paradigms. But hey, let me ask you, there's a couple people that kind of showed concern about things like uric acid or kidney stones on low carb and gout. Do you see that in practice? Do you think the ketogenic diet or even a meat heavy diet, does it seem to exacerbate that in your clinical experience? And if so, how do you manage or deal with that?
Well, that's a issue that needs a study, needs a big study, needs a comparative study. So in any clinical situation, as an internist, we see gout, we see kidney stones, and they happen at a certain rate, whether you eat carbs or not. So what's very interesting is that when you change, apologize for the train going by here, when you change the diet, however you do it, you're going to introduce different changes that could make you presupposed or susceptible to gout or kidney stones. So occasionally I see them. The rate in the one comparative study we've done at Duke, this was Will Yancey, my colleague, 2010 in the VA system, there was one kidney stone in the about 150 people on the keto, well, they didn't really achieve keto. The low carb had one kidney stone, and so did low fat. So if you only study low carb and you have 1 in 150, see, it causes kidney stones. Well, it was the same rate as the comparator group, which was a low fat orlistat study comparison. So that's going to be a question. So if 1 million people go on a keto diet, which happened in 2003, the first Atkins craze, I remember a urologist calling, there's kidney stones caused by the Atkins diet. Well, actually, we don't know that it's any more than any other sort of lifestyle approach, but everyone was doing Atkins. So everyone blamed, if you have 1 million people and you have a rate of 1 in 500, there are going to be some cases, So the gout issue is, we think, I teach this, and it's what I think I see clinically. Again, would love to have a formal study done, that the ketosis early on can interfere with uric acid excretion. So it can change the uric acid levels. And so in people who have a history of gout, you might get a flare early on. But it's actually not the meat eating and all of that. And although the purines can matter, I do remember someone who kind of forgot the idea that shellfish was something that might give them gout. And doing low carb, all the shellfish you want, it had a flare. But after you get over that hump, there aren't so many flares, or actually will go away. So if you were 100 pounds overweight and then lost the 100 pounds, you're not going to be having the same metabolic environment to create the gout or the kidney stones. So that's where it would be interesting to say, take 1,000 people who haven't eaten carbs and follow them over time and ask what the rate of a cohort study of people who are doing this now would answer a lot of these questions. And then the final thing, just if someone does have kidney stones, is we do recommend in that case that you be sure to drink lots of fluid, especially in the summer in North Carolina. If you dehydrate a little bit, regardless of what kind of diet you're doing, you can get a kidney stone. Just by chance, I have a kidney stone expert at Duke who knows a lot about this. He doesn't say don't do keto. But he will introduce something like potassium citrate or some other supplement if someone has a history of kidney stones and they still have that issue, regardless of whatever diet it is.
While we're speaking about stones, let's talk a little bit maybe about gallstones. How do you deal with people that have, obviously there's people without, a lot of people have had their gallbladders. It's kind of like if you talk to a general surgeon in the community, they never run out of gallbladders to take out. It's
Right.
ubiquitous. And then, but then you have people that have active gallbladder disease. They may have some stones, and if they eat a high-fat diet, they have, it irritates it. And so how do you manage those people that either don't have a gallbladder or have gallbladder disease and they want to do a higher fat approach? What is your way of doing that?
Yeah, there's no strong signal, so I just teach and then see what happens. I don't say, no, don't do this, or here, make these changes. So it's not a strong enough signal to tell me one approach or another. I mean, isn't it amazing that you can take out the gallbladder, you can reroute the intestines in a Roux-en-Y gastric bypass, where basically you've taken the stomach and you go right to the jejunum without all of those intestinal juices, and yet people still gain weight. And so, I mean, there is a point which when you perturb the intestines, you'll get dumping syndrome. I mean, so you might get feelings that are bad, but you still absorb enough food, even though you've messed up all of the timing and all this. So if someone asks me about gallbladder, I don't have one, I say, well, it's probably going to be fine as long as you don't. I mean, even people with gallbladders will have trouble sometimes if you're drinking coconut oil, MCT oil, and copious amounts of oil. So if you get into I'm doing keto, I must have oils, or I must drink ketone. Well, those people will often have stomach trouble, and one of the first questions I'll ask is, if someone's not doing well on a low carb diet or having symptoms like that, is what are you really eating and drinking? And so remember my view, or what I hear, is kind of like a clinical sense you get. You've heard thousands of stories and patients coming back. I've never really heard blank, the nausea after a meal. No, that's probably metformin. Or the stomach upset. Well, no, that's probably the MCT. So I can be a good sort of verifying sounding board of, no, I don't think that's from this. So that in my clinical experience, the gallbladder really, I don't know what it really did. And yeah, I've had people have to have their gallbladders out. I mean, we argue or rationalize that once the gallbladder starts to work again, because you're eating some fat, that you might push a stone out that you already had, or I guess it's possible you'll make a stone. But I'd appreciate your surgical perspective on how we can, change things internally, and people seem to do just fine.
Yeah, I mean, there is some evidence that, the common bile duct actually expands and becomes a reservoir for bile, which is kind of interesting. And so you still see this capacity even without the gallbladder to sort of put out a bolus of bile, and I don't know if it responds to CCK like the gallbladder does. But let me, because I guess you knew and spent time with Dr. Atkins at some point.
Yeah.
And, if you look at his early stuff, I mean, he was not meat averse at all. And then we saw kind of low carb go through this meat aversion phase where it was like, yeah, I'm low carb, but look at all the spinach I'm eating, and I'm eating, just, and so I think at some point we kind of went through this almost sort of I don't know if it was a capitulation to the fact that meat was bad for us, and we're going to kind of downplay the meat aspect, upplay the vegetable side. But that's sort of making some changes in there. Was Atkins truly a pretty meat friendly guy? Was he, when he originally did his stuff?
Well, I think so. I mean, I never worked personally with Dr. Atkins. One of the great interviewers and, knowledge bearers now is Jackie Eberstein. If you want to really know what was going on in their practice, she worked with Dr. Atkins for 30 years, and she's still, teaching, and I've gotten to know her quite well. Dr. Atkins, as I personally saw, so I met him a few times, just enough to ask him for money to do research back at Duke. And, we would go out for steak, and, I remember we were on the Times Square. He had a couple meetings, actually, put them on to try to get some momentum behind this. No, he was not meat averse at all. So I think what happens is the signal that this is just real food gets mixed with whatever is politically correct or politically expedient at the time. So remember back when 2003, the Atkins craze, Dr. Atkins dies, South Beach was positioned to launch like this, and Dr. Agatston, best I can tell, never really had a clinical weight loss program, but he's a smart guy. Same Agatston of the Agatston score for coronary calcium. So South Beach was ready to launch, and it was perfect because Dr. Atkins dies, deflates the Atkins enthusiasm. And what he did is he brought together the low carb with low fat. And the idea that, well, if we know low fat's great and we'll merge it with low carb, it'll be even better. So it was like a hypothesis, really. And yet it merged with the prevailing wisdom of the time. We couldn't really say eat fat 15 years ago. I mean, I would be like, eat I'd stutter a little bit because you get these glares and all. But the South Beach, in my clinical experience, helps people, and yet for the long term, it's hard to wrap your head around a fat restriction with a carb restriction, and it makes sense because it really didn't come out of a clinical practice. It was Dr. Agatston sort of merging these two concepts that don't really go together well. The clinical people say, don't worry about the fat, have lots of fat. It's satiating, it's tasty, it's what keeps you on it in the long term. So then, the keto popularity now has brought in another sort of pop culture, politically correct or not, or, it's controversial in some circles. I really haven't seen a whole lot of data on a quote keto diet with adding ketones, and the Virta Health study, which was among diabetes patients, people with diabetes, was groundbreaking in many ways. One, because they knew people were in ketosis by blood measurement. And so I guess looping back, Dr. Atkins was always a big meat proponent. I mean, don't you think the anti-meat element in the U.S., we know now, Gary Fettke and his wife Belinda Fettke kind of unearthed the whole American Diabetes Association Seventh-day Adventist beginnings of the anti-meat message. If I have a medical student who's really curious, I'll pull up remember the Matthew Broderick, he was the star in Anthony Hopkins in The Road to Wellville. It's a spoof on the sanatorium in Battle Creek, Michigan, and they didn't let you have meat and did all sorts of interesting things, electrotherapy and hydrotherapy and all this stuff. But the anti-meat thing, not a whole lot of science, really. It's that observational stuff where you can see what you want to see. You can take a small relative risk and multiply it to 1 billion people, and therefore 1 million will die, when really the error around the risk is too low to make any conclusion about it. So I'm not worried about meat. Often my patients just want to hear me say that. They just want to come to see a doctor that says it's okay to eat meat. In fact, one of my recent patients' husband said, meat causes inflammation. And, well, no, I think eating causes inflammation, but carbs cause more inflammation than meat. So anyway, if you've followed any of those other Game Changers and all those movies, they don't use logic and science. They use other methods of persuasion.
Yeah, it's wrapped up in an ideology, and it distorts their view. And like I see a lot of these sort of just snippets, partial truths. They give you a little data, and then they try to conflate it to what's going on when they leave out a lot of the details that would otherwise say, wait a minute, it's not the blood levels. Doesn't mean what's happening in your blood doesn't mean what it got there because you ate. There's this thing called the liver that sort of
Right.
changes what fat's in your blood and what glucose is in your blood, so on and so forth. And I don't know if you have any real commentary on this. I'll put it out there because so many people asked it. Do you have a view or thought about oxalates being an issue for people? I don't know that you run into that much. I don't know if that's part of your purview, but since so
So
many people asked
can
it.
you send me a study on it?
Yeah. Okay, yeah, that's what I thought. I mean, there's some people that seem to have a problem with oxalates, things. I know you're probably aware of studies on like green juice smoothies where people are just juicing like 5 cups of spinach and then they're ending up with nephritis, because it harms their kidneys. And as you're probably aware, as an internal medicine guy, most kidney stones are oxalic acid stones. But beyond that, there's some thought that it may lead to cystitis and joint issues, and it's part of there's some evidence that it shows up in atherosclerotic plaques. But I asked,
it helps to. Of course, we used to say in the academic world that you can learn. Someone gives a talk, but you really learn about someone in the questions and answers. You can ask the tough questions, and I'm not beyond the fact that, or the idea that if you stopped eating them and you were better, that's great. It's just that's not a clinical series would be, give me 10, 15, 20 people with excellent results with some change. We'd probably get that study published, but often you'll make a change. So for example, someone does a meat-based diet without oxalates and they say, well, it's because I stopped the oxalates. Well, it could have been the host of other things that have happened. These are called confounding factors. But I also wanted to say that it's important when you really get into it, to go to a meeting or watch someone speak on the subject. And I was on the same podium as, now her name's going to escape me, with someone who's speaking about oxalates being bad.
probably Sally Norton, most likely.
Yeah, it was Sally. And, as a person, she's great. We went out to dinner and all this stuff. This was in Ottawa, the Ottawa Low Carb Ottawa event. But, it was just a little too shrill, a little too alarmist without, so I'm not against, so don't get me wrong. If you've had a clinical experience and you think it's there's no need to eat oxalates, right? And it could be that is part of the 100 things that change when I put someone on a lower carb diet, when they're reducing oxalates. So that's, do you see a strong signal?
I see a few people with it. I don't know how important it is. I know Sally, and I've talked to Sally many times and met her in person. Wonderful person, but she does look at things through a lens. We all tend to do that. We see everything. When we have a lens where we look at everything and say, it's obviously due to this, and whether it's not or not, that depends. Here is a real sort of question that I think is important. Amy asked, do calories matter? That's a huge question. I don't know what your thoughts are. Do they matter?
Well, I don't really think in terms of calories. I think in terms of energy.
Okay.
I mean,
kilojoules. I don't know, joules then.
Well,
same thing, right? I mean, I know.
Well, of course they do. Yeah. And the thing is, it's more complicated than the calorie on the label on a food. So one of a useful way to think about it, was helpful for me, is that think about mass. How something weighs. I think it was a medieval experiment where they took a pound of, a cannonball and then a pound of feathers, and they went up to the top of the fortress or the castle, and they dropped they weighed the same, but the cannonball went boom, and the feathers went like this. So calories can be the same outside the human body. But when you get inside, it's analogous to friction. The metabolic cost of different foods is very different. The hormonal change of a food is very different. But I mean, all you have to do is watch on, I think it's Discovery Channel, the show Naked and Afraid. And tell me if calories don't matter. Because basically they walk around, if you haven't watched it, it's 21 days. You might want to do this, Sean, survivalist kind of guy. And they lose a pound to 2 pounds per day because they don't eat anything. I mean, I'll use this for someone who comes in and says, I don't think I sleep enough. That's why I can't lose weight. No, they don't sleep on Naked and Afraid. In fact, the bug bites are so bad, they usually, tap out. Well, I need to exercise to lose weight. No, in fact, they're not exercising on that show. Sorry. Yeah, calories matter. It's more complicated. And I don't really, it's more complicated than calories outside the body. But I think if there's a major contribution that we made, or the keto, low carb community made to the knowledge of nutrition in general, it's the idea that the hormonal response to the food really matters. And so the type of calorie matters internally. I kind of think back, Gary Taubes has done, I think he's great, known him for a long time. But the idea that calories don't matter is not the practical reality of what a physician sees in practice, but it makes good fodder for shocking people to say, oh, you mean there's more than calories?
Yeah, and we've got Gary coming on here in a little while, I think in a few weeks to talk, and he's very controversial, and I've talked to Gary a number of times, but so
ask him if he's watched Naked and Afraid.
It's kind of funny, Eric. I interviewed a gal named Kai Furneaux who went on Naked and Afraid twice, once as a vegetarian and then once on a pure carnivore diet, and she said it was night and day difference. When she was a vegetarian, she ended up having to eat some kind of lizard because she was starving, but she went back on her vegetarian diet. And it took her 2 years to recover from the 20 pounds she had lost. I mean, it took her that long to build her body back up. She went on as a carnivore, went right back into eating meat. And she said she was within 2 days back to the gym working out. So, I mean, it's just a different, what the quality of food and type of food does to our body. But,
the same kind of effect that someone like Zach Bitter, who runs 100 miles. So people who run a long time can run a long time the next weekend again. The recovery time seems to be less. Now, that's way out of my field. I just kind of listen to people tell me that.
Yeah, and I know Zach very well. We co-host a podcast together, and he just broke for the people to know. He just broke the 100-mile. So he has a world record for 100 miles on trail, on track, and now treadmill. He just did the treadmill one in 12 hours and 9 minutes the other day, and he has gone on he's been low carb for a long time, for like a decade or so, but he's gone meat heavy quite a bit. He's eating two pounds of red meat every day. And he says now his recovery is phenomenal. It used to be he would run one of those races and couldn't walk for 3 days. And now he's like doing squats the next day, and swelling is gone. So it does, it does have an impact on our body, inflammation, recovery, so on and so forth. And to me, it makes sense. You beat your body up, you break down muscle, you break down lean tissue. The best way to restore it is, the most efficient way is animal products, in my view. But anyway, Eric, we're coming to the hour. It has been such a pleasure talking to you. You're such a wealth of information. I hopefully, you can get back on the road and doing your ADAPT thing. And if we can support you in any way, let folks know where to find out more about, what you're doing, either social media or your ADAPT program, where they can find your ADAPT products if they want to use that, include that as part of a low carb,
Yeah, we have real tasty stuff now. It took some years to get things better and better at adaptyourlife.com. So ADAPTYOURLIFE.com. I also have a website, just drwestmanonline.com, that kind of gives where to find things. The YouTube channel at Adapt Your Life is quite popular. People like to watch, it's not just videos from me, it's from people who were at the ADAPT events over the last 18 months. I'd love to do more or facilitate the collection of data, if possible, for those who are willing. And I think what you're doing is fantastic, Sean.
Yeah, if like I said, we did get David Ludwig to get that thing through the Harvard IRB. So we've got this carnivore thing in process right now. I think they're finishing up data collection right now. And so we are excited, if it's possible to do more, in the research realm. And I think we can get volunteers pretty easily to look at things, and maybe interventional type things, depending on. And I've actually talked with some meat producers. Well, I don't know, again, the funding sources are always kind of squirrely where you get your money from, but I mean, I know there's people that are willing to provide meat for studies. I mean, you could even just get somebody to provide the meat for it, which would be interesting. So thank you so much. I've got to run and do this. I've got another meeting. I got to go to a public meeting. So you guys that want to join and continue the discussion, that's great. Eric, thank you so much. Have a great day and keep doing what you're doing.
My pleasure. Thanks.
All right, I'm going to shut down, guys. Okay, take care, everybody.